All right, team, welcome to Scaling Skinny to Sculpting, your guide to the weight loss revolution. Anyone that follows us on Instagram at Austin Plastic Surgeon knows that the weight loss revolution has been near and dear to my heart and obviously to our practice, something that both Nurse Sarah and I have had personal experience with and living our fit and fabulous life. You know, it's been eye-opening to us in terms of how we've actually managed our aesthetic practice and the non-surgical side of this. I think the GLP drugs are probably the most revolutionary medication to come to the United States, definitely in my medical career. So we want to create a turnkey solution that's going to help your practice, but also help your patients really reach their aesthetic goals. I think, you know, the idea behind our program, and you'll see as we go through this, is going to be more than just the weight loss revolution. It's really how you manage your non-surgical and eventually your surgical patients in terms of things, because I think there's a real process to be able to help your practice not only survive, but thrive in this economic changes. So we have our dream team here today because we're going to go a little bit through all the things that are included in the program to help your aesthetic practice just continue to grow over these economic changes. And so we're going to do everything from marketing.
That's right. I'm Sarah. I'm excited to be walking along this journey with y'all. You can build this awesome weight loss program, but if you don't have patients coming in, then obviously that won't do you any good. So we're going to teach you all about social media, marketing in general, email drip campaigns, and how to really move them along the funnel once they come in for that skinny shot.
And then, Jenna, we're going to talk about lead management, because it's one thing to generate all these leads, but then what do you do once you get them, and how do you kind of move them through the process to make sure that they're well educated, well prepared for their consultation?
Absolutely. We have really optimized how to not only nurture those leads very well, but incentivize your sales team to make sure that you're growing your practice and your leads and the patients that are coming into the practice. So super excited to share that with you guys.
And then Heather has really developed, and under her guidance, you know, our conversion rate, you know, from the time patients come in from a consultation to actually booking the procedure of their dream, you know, has increased by over 20% in just 1 year. So I think there's some really cool ideas and itemized and structure that's going to help with that. So Heather, you're going to guide us through that maybe a little bit later in the program.
Yes, absolutely. It's super exciting. Lots of relationship building and kind of figuring out how to get clients not only in the door, but also staying and retained within the practice.
The whole program is going to be absolutely fabulous. And so, you know, we've created a table of contents here just to really give you a good idea of all the things that are going to come. We've already talked a little bit about this, and I know that the compound pharmacies are always the one that people get the most notoriety, because that's probably the biggest question that people have in terms of really implementing this, because I think a lot of aesthetic practices have used compounding pharmacies to a very, very small degree, typically for numbing cream, other things like that. But really the next level, and you're going to see over the course of this program and the course of the year, you know, it's the weight loss revolution, but we're also going to start to share with you guys phase 2 of this, which is beyond the weight loss revolution, and really how you kind of move this and so many other things in the wellness aspect that I think is going to be an integral part of your practice and aesthetic medicine for years and years to come. So super excited about that as we kind of go through the process. I think our team here is going to share, you know, every step of this and really in depth, and you're going to see throughout some of these videos. We're going to try and make them short and quick to the point, so about 15, 20 minutes as I'm talking endlessly, but something that you can do on each car ride and really just take home a few little stuff. Not all these ideas are ours, but stuff that we have accumulated as a group over our 15, 20 years of practice in terms of this. So I think it'll be super exciting. When we talk about leads, you know, Sarah's actually going to share some of how we've done social media ads, how we've done, you know, really kind of creating our marketing program.
Yeah, absolutely. We even want to provide some kind of cut and paste templates for you. So if you are starting from scratch, we want to make this as easy as possible, but they're completely editable. So you can make them yours. You can put your brand on them. We also will teach you how to create new things, so you don't have to just use what we're providing. So we really do want to make it like a full toolbox to make it as easy as possible for you.
And then Heather, you've actually worked really, really hard with compounding pharmacies throughout the country. And so we actually have a really cool roadmap that shows every state in which we have partners. Those partnerships are only getting stronger and stronger. At our courses, we may even have some of the compounding pharmacies come to be able to answer some of your questions and be an integral part of this. So super excited about those relationships and being able to introduce some of our partners with these compounding pharmacies.
Yeah, absolutely. It's super exciting because in the beginning, it was very overwhelming to kind of learn how to work with some of these pharmacies, the questions that you need to ask. So we've gone through that entire process for you. We have partners ready to go for you. And then also, if you're looking to form your own relationships, we have kind of an interview process of exactly how you can do that as well.
But so great because people can just get started without having to do
Yes.
all that legwork, which wasn't easy at the beginning. And then if they want to expand, they already know what questions to ask in terms of that. I think some of the other things that I'm super excited about, we've spent a lot of time trying to refine the process stuff, and we're even going to share some of those things about how we do commissions, how we do process things, how we follow up with those leads. And I know, Jenna, you've been working really, really hard to streamline that. And sometimes people don't even know, like, where do I start? What's fair? What's in the market? And we've done a lot of research for that.
Absolutely. We've done a few different trial and error things to figure out what works best for the staff.
Definitely trial and error.
Yes. But we have really fine-tuned that system to really optimize the process. That way you get the most out of your leads, the most out of your staff, and everybody ends up super happy.
Our team, and now I want to show you some of the highlights that, this has really been able to enable for our practice. One of the things that we're most proud of is being able to increase our overall monthly patient visits, because you're going to see that weight loss has really been a lead magnet to generate patients into the office and then really get them along their aesthetic goals through other stuff. But really, really hard in very competitive cities of how you can reach and resonate with a lot of patients. You see, for us, I mean, our numbers in terms of patient visits have exponentially grown to almost 3,000 patients visits per month. I mean, if you think about that number coming through your office every single day, I mean, that is absolutely phenomenal, priceless in terms of growing your overall practice, because now, whether you're bringing on new surgeons, new injectors, new estheticians, it gives you an opportunity to get in front of those patients and then really kind of showcase your talents and skills. So something I'm super, super excited. I'm going to show you how we've done this. We'll take you step by step through all of that. But even more than that, you can see that, we have changed because our program really developed, and I, like many plastic surgeons, aesthetic surgeons out there, had a med spa, and just kind of trucked along for probably 7, 8, 9 years. And then last year really made some transitions. One, hiring a med spa coordinator, but hiring the med spa coordinator was more than just adding one person. It was really a philosophy, a change in terms of our program of the TLC and care. Looking back, it just didn't make any sense, right? We didn't give any care. We didn't put the same time and effort. We didn't put the marketing efforts into it. Just like anything in your practice, whatever you put effort into is going to grow. And so it was a side project. So then it was almost a side, growth stuff in terms of now that it's become a focus, it switched from the surgery side being the generator of patients for our med spa actually generating patients for our surgery. So very, very synergistic in terms of how this has been able to grow for our 2 injectors.
Yeah, absolutely. As an injector myself, it's been awesome to have this steady flow of weight loss patients that not only obviously bring the revenue from the wellness program, right? But now we're seeing them and they've got these new concerns that come with weight loss that we have this awesome opportunity to help correct, right? So they're feeling fit and fabulous on the inside and the outside, but maybe they've got some loose skin. Maybe they've got some new things that they didn't notice before. So we've really come up with some techniques to be able to ask them what really bothers them and come up with a customized treatment plan. So these patients keep coming back. So the growth is not just in the wellness, it's really been all of our non-surgical revenue. So for us, that's been really awesome. Wouldn't you agree, Jenna?
100%. Every patient that comes into the office is an opportunity. So to have over 3,000 patients coming through is amazing. And once you're able to really help them with a huge pain point, such as weight management, they then trust you so heavily to help them through the rest of the process because they're feeling so fit and fabulous that they want to continue on in that journey.
But it always can be a little bit more challenging. And we've definitely have gone through some of the struggles. It's not quite as easy as you would think that they're just going to passively flow, right? That was the mistake when we were talking about surgery, that people were just going to passively go to the med spa. If you think they're just going to passively go from weight loss to your other med spa non-surgical, you're going to make the same mistake. So, some of the things that we've been refining with our coordinators and our process for that.
Yeah, absolutely. Our coordinators and providers have actually been working really closely together to make sure that the patient feels really well guided from the time that they call into the practice. They're guided through the process, exactly what they can expect when they come in. The providers looped in kind of on what the conversation was, what the patient's hoping for, their goals, their budget, their time frame, so many different things that kind of go into each patient so that we're really guiding them through the entire process and they feel really well supported.
You could see that when you talk about this, you can see the overall non-surgical revenue has absolutely exploded, and when you can help patients reach their absolute dreams, their biggest pinpoint was, this weight gain. And when you can fix their biggest problem, they're super excited. I mean, we have patients that just really want to continue to look as fabulous as they feel. And so this just becomes outstanding. I mean, the one thing that, obviously practices get excited about the revenue growth, but I'll tell you the reviews that we get from patients who have gone through this weight loss revolution stuff stuff have been more powerful than almost any of my surgery review stuff. So super interesting about how this is resonating with patients in such an impactful way for them. To summarize this, just want you to think about this, whether you actually want to become weight loss to be a huge part of your practice or not. I think really understanding the weight loss revolution, I think understanding, that you need to speak and resonate with these patients is going to be absolutely priceless if you want your practice to thrive and not just survive going forward. The weight loss revolution is not going away. Most of these industry companies have invested heavily in this. You're going to see new medications coming out for at least the next 10, 12, 15 years periodically. So I think there's so many changes, so many things coming. I also truly believe that you're going to see some paradigm shifts in terms of the aesthetic world. I think it's up to us as providers to really kind of dictate how that's going to come, how we're going to treat patients. We're going to get into some of the unique patient base, and I think there's some unique opportunities, but some unique challenges. But where challenges lay, there's opportunities for those practices that want to really kind of take a leadership role in this. So super exciting for all of us, and we really can't wait to share all that with you guys. So we'll see you soon. We're getting this started. Bye.